Gentlemen, today I'm going to talk to you about something that keeps millions of men awake at night, but very few dare to discuss openly. How to get the penis hard again for the second round, and more than that, how to maintain reliable intimate performance, whether on the first, second, or as many times as you want. Maybe you've been through this situation, or know someone who has. After the first intimate encounter, the erection disappears, desire diminishes. Regaining firmness to continue seems like an impossible mission. And look, I know that for many men this is a reason for frustration, shame, and even fear of losing their partner's trust. But before I continue, I need to tell you something I hear every day in my practice here in New York. Many men, mainly over 60 years old, come to me and say, "Doctor, my problem isn't even the second round. I'm having difficulty already with the first." And you know what I answer? This is much more common than you imagine, and it has a solution. So stay with me until the end of this video, because I'm going to explain everything. From the physiology that explains what happens in your organism, to the most effective solutions you can apply starting today. And I'm not talking about miracles or passing tricks. I'm talking about changes and techniques that will make your body respond the way you want. My name is Dr. Theodore Chambers. I've been a urologist for over 15 years, and I've treated thousands of men with this same problem. And what I want you to understand from the beginning is this. This isn't a whim of your body or an inevitable failure of age. There are very clear medical explanations, and most importantly, there are proven strategies so that a man can become firm and ready again for a second encounter, even at more advanced ages. Let's by understanding what medicine calls the refractory period. This is a time interval that passes between ejaculation and the possibility of having another erection. In younger men, this period is usually short, sometimes just a few minutes. But with age, this interval increases, lasting from several minutes to hours, in some cases even days. And why does this happen? Because after ejaculation, your organism enters a state of physiological recovery. Dopamine, that neurotransmitter very linked to desire and pleasure, drop in compensation. Prolactin increases, and this generates a sensation of sexual satiety and diminishes the erotic impulse. Besides, the blood vessels of the penis take time to respond again to stimulation, since the relaxation of smooth muscles needs time to recover. Understanding this is fundamental. It's not that your body is damaged. Your biological mechanisms have different rhythms with the passing of years, and this is completely natural. However, yes, it's possible to optimize these times and achieve firmness again for a second round with discipline and knowledge. Now, I need to address something many men ask me. "Doctor, I'm over 60 years old and I'm having difficulty already with the first erection. What do I do?" Look, this is extremely common and doesn't mean you're doomed. Difficulty in the first erection is generally linked to the same factors I'm going to explain here. It can be a vascular, hormonal, emotional issue, or a combination of everything. The important thing is to identify the cause and treat it. So, let's talk about the factors that influence recovery and erection quality. First, age. The more years you have, the greater the difficulty to become erect again quickly. This is a fact, but age isn't a sentence. I have 70-year-old patients with active and satisfactory sex lives. Second, physical condition. A body that exercises regularly responds much better to the circulatory demands that an erection requires. The sedentary man has much more difficulty. Third, vascular health. Healthy arteries allow blood to flow quickly and forcefully to the penis. When arteries are clogged or hardened, erection is compromised. Fourth, hormonal balance. Low testosterone levels can prolong recovery time and diminish erection quality. This is very common in men over 50 years old. Fifth, mental state. Anxiety, fear of failure, and emotional tension block the natural mechanisms of erection. And look, this factor is much more important than most men imagine. And there's another important factor: chronic diseases like diabetes. Diabetes, when not well controlled, causes damage to the nerves and blood vessels of the penis. If this is your case, know that specific treatments exist. Seek a urologist to evaluate available options. All this means that the second round doesn't depend solely on your desire. It depends on a combination of your physical state, your intimate health, and your mind. And that's where the strategies I'm going to teach you now come in. Strategy number 1. Physical exercise. Exercise is the foundation of any plan to improve sexual performance. When you train regularly, your circulation improves, your heart pumps more efficiently, and blood flows with more power to the penis. This not only facilitates the first erection, but also reduces the time you need to achieve the second. The most recommended exercises are cardiovascular, like walking, running, swimming, or cycling. They strengthen the arteries and improve vascular elasticity. Strength training also helps a lot. It increases testosterone levels and keeps pelvic muscles active, especially the pubic-coccygeus, directly related to rigidity and the ability to maintain erection. A man who dedicates at least 30 minutes per day to exercising has much more probability of recovering firmness quickly. This is proven medical fact. A walk in the park, a bike ride around the neighborhood, some exercises at home. The important thing is to create the habit and maintain consistency. Strategy number 2. Correct nutrition. What you eat largely determines how your penis responds. Foods rich in antioxidants, vitamins and minerals help blood flow with less resistance and tissues recover faster after ejaculation. Some foods I always recommend are fruits rich in citrulline and arginine, like watermelon. It favors the production of nitric oxide, fundamental for erection. Fish like salmon, sardines, and mackerel are rich in omega-3. They protect arteries and facilitate circulation. Nuts and almonds contain healthy fats and improve endothelial function. Green leafy vegetables like spinach provide natural nitrates essential for blood vessel dilation. When your diet is deficient in these nutrients, the body takes much longer to send quality blood to the penis after the first encounter, and the second round becomes difficult or impossible. Strategy number 3. Rest and stress control. One of the silent enemies of erection is stress. When your body is in alert mode, it releases cortisol and adrenaline, two hormones that block sexual response. Even if your desire is great, the sympathetic nervous system prevents blood vessels from dilating. Besides, if you don't sleep enough, your testosterone drops, and with it your ability to have quick and firm erections. A man who sleeps less than 6 hours per day has much lower intimate performance than one who respects his rest cycles. I know life is hectic. Work, family, bills to pay, worries, everything weighs. But part of the secret to achieving a reliable second round is learning to relax, control anxiety, and allow your body to recharge. Techniques like deep breathing, meditation, or simply creating an intimate environment without pressures can make all the difference. Strategy number 4. Mental stimulation and foreplay. The second round depends largely on mental stimulation. Different from the first, which is generally loaded with accumulated desire, the second requires more work in arousal, prolonged foreplay, physical contact, open communication with your partner, and adequate erotic stimulus help the brain release dopamine and activate the sexual response again. Remember that the penis doesn't work alone. It's part of a neurological circuit that begins in your mind. If you trust only the initial impulse and don't dedicate time to recreating excitement, the second round becomes unlikely. Talk with whoever is with you. Discover what excites you both. Invest in foreplay. This isn't wasted time. It's a fundamental part of the process. Strategy number 5. Train the pelvic floor. The muscles surrounding the base of the penis are responsible for rigidity and ejaculation control. When these muscles are strengthened, you not only maintain the first erection with more firmness, but also recover tone much faster for the second attempt. Kegel exercises are simple to do. You contract the muscles as if trying to stop urine flow. Hold for a few seconds and relax. Do this several times daily, every day. Over time, you'll notice an enormous difference in your intimate endurance and performance. Strategy number 6. Adequate frequency. Many ask me, "Doctor, I'm over 60 years old and like to have relations every day. Is this harmful?" The answer is, it depends. If you're managing to maintain that frequency without difficulty, without pain and without forcing anything, probably everything is fine. Actually, maintaining regular sexual activity can even be beneficial for penis health, because it keeps tissues active. However, if you're noticing you need to make too much effort, that you're having erection difficulty or feeling some discomfort, it may be a sign your body needs more recovery time. In that case, decreasing frequency a bit and focusing on quality instead of quantity can be a good strategy. Most important is listening to your body. Strategy number 7. Control chronic diseases. If you have diabetes, hypertension, or any other chronic condition, it's fundamental to keep it well controlled. These diseases directly affect erectile capacity. A diabetic with uncontrolled sugar has much more probability of having erection problems than one with adequate treatment. Strategy number 8. Don't be afraid to seek medical help. Although everything I mentioned is fundamental, we can't ignore that some men need direct medical support. In cases of persistent erectile dysfunction, hormonal problems, or vascular damage, effective treatments exist. There are medications that improve erectile response and are very safe when used under medical guidance. There are hormonal therapies for those with testosterone deficiency. There are specific procedures for more complex cases. The important thing is not to stay silent or resign yourself to frustration. Consulting a specialist is a courageous step and the key to finding safe and lasting solutions. I know that for many men, there's still a taboo about talking about these subjects. But look, I've been treating patients for over 15 years, and I can guarantee you, you're not alone. Thousands of men go through the same situation and find solutions every day. Many of my patients arrive at the office thinking their problem is hopeless. Men of 60, 65, 70 years who had already given up on having a satisfactory sex life, and after some months of treatment and habit changes, they return completely different, confident, satisfied, with very high self-esteem. So let's recap the 8 main strategies. First, understand that the refractory period exists and is natural, but can be optimized. Second, practice physical exercises regularly. Third, take care of your nutrition with watermelon, fish rich in omega-3, nuts, and green vegetables. Fourth, sleep well and control stress. Fifth, invest in foreplay and mental stimulation. Sixth, strengthen the pelvic floor with Kegel exercises. Seventh, keep chronic diseases well controlled. And eighth, don't be ashamed to seek medical help. I want you to take this message. Your intimate life doesn't need to be limited to a single attempt. With discipline, knowledge, and when necessary medical support, you can become firm again whenever you desire, providing confidence, satisfaction, and fulfillment. It's not about quantity of years, but quality of life. And in male intimate health, quality is built day by day with small habits that transform your body and mind. Theodore Chambers, urologist for over 15 years, and my mission is to accompany you on this path to recover your vitality and confidence. Now I want to know from you, what's your biggest difficulty when it comes to maintaining intimate performance? Leave it here in the comments because I read them all, and often your questions become the topic of new videos. If you know any friend who needs to hear this, Share this video with him. Sometimes we can help someone just by passing along information that changes that person's life. If you're not yet subscribed to the channel, subscribe and activate the bell. Every week I bring content about men's health. Take good care of yourself.